We're going to move on to our GMA cover story. More on that groundbreaking surgery, the world's first successful face and double hand transplant. 22-year-old Joe DiMeo underwent the marathon operation after a horrifying accident. And Dr. Eduardo Rodriguez, who led the transplant team at NYU's Langone Medical Center here in New York, joins us now. Good morning, doctor. Congratulations. Thank you for that incredible story that we all covered earlier this morning. Let's begin at the beginning. Why was Joe the right kind of patient for this surgery?
Good morning, George. Joe's the perfect patient. He's young, he's healthy, strong, no medical problems, no history of mental illness, comes from a very supportive family, and he has a secret element, which is he's a highly motivated individual. He's the perfect patient for this type of operation.
What a triumph of technology and teamwork. The procedure took 23 hours, involved dozens of people, and you practiced and rehearsed, I know, for months, but then the pandemic hit. How did that set you back?
That was a difficult time for us. We had to kind of redirect our emphasis on caring for patients during COVID. But even during that time, we never forgot about identifying Joe's donor. And we had to pare down our team to continue practicing in our surgical skills lab, not to lose any of our skills. We were concerned about potentially bringing COVID with either Joe or our donor, but ultimately we were perfectly prepared and everything went without a hitch.
You said that finding a donor was like finding a needle in a haystack. Explain what you mean by that.
Yeah, Joe underwent many surgeries following his initial accident. He received many blood transfusions, many skin grafts, and that raised his antibody levels to about 94%, which meant that he had a 6% chance of identifying a donor. Normally, we identify the donor in New York, but because of this rare concern that we had to identify his donor, we went to an entire nationwide search, and that dramatically changed and opened up our donor pool and made the identification of a donor a lot easier.
There's so many follow-ons from this type of surgery. It's such a major advancement, but how is it going to help people beyond this particular procedure?
Well, we now know that we can perform this operation safely. I've personally performed faces, but the fact that we can include other tissues now with the transplant and the face with two hands, we know that we can continue to extend and transplant additional tissues. And I think with great advancements in medicine that have allowed us to perform these operations precisely, saved tremendous critical time in the operating room, we'll be able to do these operations quicker, safer, and expand it to broader horizons with patients with great deformities.
We heard Joe talk about the moment when you first saw his face. As his doctor, what was it like that moment when you finally got to shake his hand?
It's great. It's an incredibly proud moment. I'm incredibly proud of our team and our institution, but just to be able to feel his hand and his grip strength and his warmth, you just know that it's a culmination of a tremendous amount of work on everybody's part, and to feel that hand inside mine, it's an amazing feat, and I'm incredibly elated that this was able to happen.
Well, you did amazing, groundbreaking work, Dr. Rodriguez. Congratulations again to you and your entire team.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.